Hello, everyone. I am Ayan Mahmood. I am a public health support officer with the Bold Healthier Champions team. Today, I'll be talking to you about physical activity and behavior change webinar. So, what is physical activity? Physical activity is all movement, including during leisure time, for transport to get to and from places, and as part of a person's work. Some of the questions that could pose participants thinking about their own physical activity includes: what type of movement do you take part in daily? Do you know how much physical activity is necessary? What is your regular mode of transport, and do you have a favorite type of physical activity? What are the benefits of physical activity? The UK Chief Medical Officer said in 2019, if physical activity were a drug, we would refer to it as a miracle cure due to the great many illnesses it can prevent and help treat, such as dementia, such as cardiovascular disease, such as type 2 diabetes, such as colon cancer, and also depression. There are wider benefits, such as a viable working population for employment, such as reduced social isolation, such as increased academic attainment, an improvement on employment chances, and reduced traffic congestion, and amongst other things, improved air quality. So why does physical activity matter? Physical inactivity is one of the top three drivers of premature mortality. It costs the UK 7.4 billion annually, 900 million of that is for the NHS alone. Being active every day can reduce the risk of 40 different diseases, and being active daily can improve clinical outcomes and reduce symptoms for those living with the disease at every age. So, what are the guidelines? There are physical activity guidelines from the UK Chief Medical Officer's report on the government website. There are physical activities for early years, that's 1 to 5 years old. And then there is one for children and young people from 5 to 18 years old. And then there is one for adults and older adults. So there are three different types of intensity levels when thinking about physical activity. Moderate intensity, moderate level intensity of activity noticeably increases your heart rate and breathing rate. You may sweat, but you are still able to carry a full conversation. You can talk, but you can't sing. You feel like you're exercising, but you're not huffing and you're not puffing. The NHS physical activity guidelines for adults suggest aim to be physically active every day, even if it's light activity. Do at least 150 minutes of moderate intensity activity a week and reduce time spent lying or sitting down. There is vigorous activity. Vigorous activity is done with a large amount of effort, resulting in a higher heart rate, and quick breathing. It's difficult to make full sentences. Activities such as running, cycling, and tennis are usually classified as vigorous, and the NHS physical activity guidelines for adults suggest the aim is to be physically active every day, even if it's just light activity. Do at least 75 minutes of vigorous intensity exercise a week. Reduce time spent lying down as well. And finally, there's strength and balancing. Strength training is key component to overall health and fitness of everyone. It is recommended that strength and conditioning training could be done to the point where you need short rest before repeating the activity. Examples include Pilates, yoga, weightlifting, gardening, or carrying heavy shopping. The NHS physical activity guidelines for adults suggest the aim to be physically active every day, even if it's um, light activity. Do activities that improve strength, balancing, and flexibility at least 2 days a week. Reduce time spent sitting or lying down, and break up long periods of not moving by doing some sort of activity. There are levels of physical activity in adults in Birmingham. Those with dark blue are inactive, moving less than 30 minutes a week. Those in pink are fairly active. They move 30 to 149 minutes a week. And those that are light blue are active and move at least 150 minutes in a week. So there are activities to help improve aerobic capacity, balance, and bone health. such as running, resistance training, aerobic circuit training, ball games, racket sports, yoga, tai chi, dance, walking, and cycling. So how active is Birmingham? 55% of adults in Birmingham are active with at least 30 minutes of exercise per day, and 42% of children and young people are active at least an hour a day. So what are the inequalities within Birmingham? There is an underrepresented groups. Inequalities in physical activity exist across a number of underrepresented groups and long-term health conditions for certain ethnicities. There's deprivation, so physical inactivity is strongly linked to deprivation. There's age, you're more likely to be inactive if you're younger or an older person living within the city, and gender. Women and girls are more likely to be inactive. There are barriers people face when being physically active. We're going to discuss the barriers and ways to overcome them. So the first one will be lack of time. Identify a suitable time slot for your physical activity. Make it a part of your daily routine. Select activities such as walking, jogging, or climbing the stairs, or walking in between meetings. There's social support, so share interest into physical activity with family and friends, ask for support, and develop friendships with physically active people. Lack of energy. Schedule physical activity when you are feel more energetic during the day. Convince yourself if you give it a chance, activity your activity levels will increase and your energy will as well. If there's a lack of motivation, plan ahead, put it into your calendar, invite friends to join the exercise group. If there is a fear of injury, warm up and cool down to prevent injury. Exercise appropriately for age, fitness level, health status. Choose activity you can do safely and slowly and increase the amount you do to grow your confidence. If there's a lack of skill, select activities that you require new skills, walking, climbing the stairs, jogging, that type of thing. High costs and lack of facilities. For example, select activities that require minimal equipment or facilities. For example, walking, jogging, skipping. Identify inexpensive, convenient resources available in the community or speak to your GP about referral programs. And finally, there's weather conditions. So develop a set regular activities available regardless of what the weather is, including dance, indoor swimming, skipping, or at-home activities such as um, um, indoor cycling, and exercise videos at home. So physical activity and the combi model. Physical activity can benefit both physical and psychological health. The combi model, which is a behavior change model, can help us understand individual behavior. Being physically active each day can be influenced by what we know and what we can do, our capability, the people around us, and our physical environment, our opportunity, and our beliefs of what we want, how we see ourselves, and how we regulate our emotions and our habits, which is our motivation. So, how can we be more active in Birmingham? We can find motivation to be more active. Do what makes you feel good. Make it fun. Be sociable. It increases confidence and self-esteem. It prevents poor health and saves money and is good for the environment as well. So, how can we increase physical activity levels in individuals? So, make small changes. Take the stairs. Incorporate walking into your commute or the school run. Lunchtime away from your desk, walking, running, or cycling, alone, with family, with friends, or with a group, taking up group classes, having a personal trainer, or having sports. It can be organized or informally with friends and family. So there are opportunities to be more active in different settings within Birmingham. And then the advice is to make use of the free activities of your local leisure centre, explore local green spaces, learn to ride, increase cycle confidence with Active Wellbeing Society, ditch the car for short journeys to save money on travel costs, and check if your workplace has bike to work scheme as well. There are support available for those in Birmingham to be more active, including Be Active and the Birmingham Wellbeing service as well. And things like Park Run, Sport Birmingham, Connect Sports, a Couch for 5K, and Active 10, sorry. There are other resources that are within this slide deck that will be distributed to you all as well. So what can we do to help? This is where the Bolder Healthier champions come in. As your role as a Bolder Healthier champion is to talk about the importance of being physically active, um, to share the important health messages by distributing the information you have learned into your communities. Connect people to resources that help them or someone they know, whether through a website or through a helpline or an organization. And finally, feedback to us. Is our information useful? What other information do you think will help? What else do you think would get the message across? Is there a particular topic that you would like to hear from us? Talking should always be done with the intention of helping connect people to their right support, not taking the responsibility of offering professional guidance. Always use approved information and try to remain neutral. Don't get personally involved with people that you're trying to help as well. So, what do you talk about? So, you spot people who may need your support. You share the messages and encourage people within your communities to go and be more physically active. And you promote the webinars within your network as well. So, this is an example of how you can offer help without getting personally involved. You can offer brief, um, immediate support and to find out what help is needed and when to direct the person to the resources we have provided you with. So, Elle is a physiotherapist and a Boulder Healthier champion and recently attended the physical activity webinar. Simon is a client of hers and is new to the area. So, sometimes you can help someone best by offering practical support, especially if they're struggling to find time for the research or information for themselves. Elle has then signposted Simon to the different activities and supports available. And here is a directory of resources as well. And the slide deck will be distributed where you can look at your own leisure. So you are our eyes and our ears of the community. You can tell us where more help is needed and how best to provide it. Email us or connect us through our social media at any time. We hope that you're enjoying these sessions and enjoying promoting positive health and supporting your community to improve their health and well-being. We want to thank you for volunteering to be a Bolder Healthier champion. Your role as a Bolder Healthier champion is to share the information into your communities to encourage people and support them to be more physically active. Our champions are advocates for important health messages in Birmingham by distributing information into a wide range of communities and networks. We support you through monthly themed webinars and tailored resources packs. We have previously covered physical activity and how it can incorporate into our daily lives, as well as the benefits from increasing regular activities, even in small ways. We have also covered cost of living crisis, diabetes, and sexual health as well. You know, if you know someone who might be interested, then please encourage them to find out more by either searching Bolder Healthier Champions Birmingham City Council or by sharing the link when you receive this slide deck. And finally, thank you for joining us today. We could not do this without you.